Hello, today's topic is left superior vena cava. Well, we all know right superior vena cava drains into right atrium, but it's the congenital anomaly when the left superior vena cava persists and drains into the coronary sinus usually, and through coronary sinus it connects to the right atrium. So here persistence of left superior vena cava is an important finding which we must identify by echocardiography. Well, if you can imagine that left superior vena cava is there and it is draining into the coronary sinus, the coronary sinus will be carrying the blood of left side of upper limb and head and neck and will drain into the right atrium through coronary sinus, so the coronary sinus will be dilated. Well, let's come to the dilated coronary sinus. A long axis picture quickly identifies the dilated coronary sinus as we have seen the position of coronary sinus and their dimensions in previous video. So please try to locate the coronary sinus, and once you find the dilated coronary sinus, your attention should go towards persistent superior vena cava, because that is the commonest cause of such a dilatation of coronary sinus. Other causes might be any cause of raised right atrial pressure. A modified view of apical structures where you can see the LV apex and little towards posterior tilting of the transducer, you will be able to see the dilated coronary sinus which is going into the right atrium. It looks as if there is a atrial septal defect. Yes, there can be a true atrial septal defect, but in this case it is not a atrial septal defect but a dilated coronary sinus which is carrying left superior vena cava blood is draining into the right atrium. In this view you can see the color flow into the coronary sinus and through tricuspid valve to the right ventricle from right atrium. These flow can confirm that this is a venous flow draining into the right atrium. Now we are going to do air bubble contrast study. We have pushed saline air bubble agitated contrast into the left cubital vein, and it quickly fills up the coronary sinus. As you can see in this picture that the coronary sinus is getting filled up. So the coronary sinus is getting filled up. After coronary sinus you will be seeing the contrast is going into the right ventricle. So it proves that left superior vena cava is directly connected to the right ventricle through coronary sinus, and that confirms the coronary sinus persistence of left superior vena cava. Seen in enlarged coronary sinus in a off-axis view which you can visualize here, and it's going into the right atrium and right ventricle directly can be seen here. Let's go to quickly subpostal view and visualize that there is no atrial septal dropout actually in this case, which can be confirmed by color Doppler as well. But here we are going to do something more. We are going to push air bubble contrast in left hand, left cubital vein, because it's the left superior vena cava we want to visualize and it going to the coronary sinus. we must exclude atrial septal defect, which is a common associate with persistent left superior vena cava, by looking at the contrast study as well. Like in this case, you can see the contrast is present in the right side, but there is no contrast coming to the left side, which could have occurred due to atrial septal defect. So this is only persistent left superior vena cava, but no atrial septal defect associated with it. So this was a short video on persistent left superior vena cava draining into the coronary sinus and joining to the right atrium. These kind of videos, small videos, we will be posting in our channel. So please subscribe and share our channel with your academic friends. Thank you very much.